I thank my colleague from Nevada for letting me speak for a moment in response to the comments that were just made by my colleagues on the other side of the aisle about the legislation before us, which is legislation to address this horrible problem we've now got in all of our states of the addictions that are caused by heroin and prescription drugs. About 100 people will die today from overdoses, and that's just the tip of the iceberg because there's so many other people whose lives are being ruined, families being torn apart, communities devastated. And this legislation was drafted by Senator Whitehouse, myself, other members of this body over the period of the last few years, including 5 summits we had here in this Congress to bring in experts from all over the country on prevention and education, treatment and recovery, dealing with the law enforcement side and the importance of having Narcan available, also helping to get prescription drugs off the bathroom shelves and ensure we had drug monitoring programs. It's a comprehensive approach. I will say I disagree a little with my co-author, my colleague from Rhode Island, in saying that if we could pass this bill, that there would be no funding for it somehow. There was a huge increase in funding, as everyone knows, at the end of the year for opiates. Senator Whitehouse and myself and others approached the appropriators, asked them to be sure that that funding was consistent with where we were on CARA at the time, and then in the Judiciary Committee, when we had some jurisdictional issues, we worked hard to draft the legislation so that if we could get it enacted this fiscal year, that's between now and September 30th, there would be funding help us to be able to accomplish what's in the legislation. However, as my colleagues know, this is an authorization bill. What does that mean? It means it's a bill that directs how funding will be spent. It's not a spending bill. Now, having said all that, as Senator Shaheen knows, I supported her efforts to add additional resources over and above what could be spent this year on CARA, because I believe this is such an urgent problem, and I believe that it does rise to that level of being an emergency. That's saying a lot. I'm a fiscal conservative, but that means it's not paid for by offsetting other programs. It's just additional funding because it is such an urgent need. We've done this on other occasions with health care emergencies. When we have something like the Ebola crisis, well, I think this is a crisis too. So I voted with Senator Shaheen today. I'm a co-sponsor of her amendment. I support it. But I don't support the efforts of some who say somehow there's no money in here. This is an authorization bill. This is the first step toward getting the money, not just this year, but into the future. That's the point. Back in the House, I was the author of the Drug-Free Communities Act. 19 years later, $1.3 billion has been spent in support of the Drug-Free Communities Act, helping to create over 2,000 community coalitions, including in just about every state represented in this body. Was that a spending bill? No. It was like this. It was an authorization bill to direct the spending based on a lot of research and effort, evidence-based practices we know would work. That's what this is. This is taking it to the next level and specifically directed at the points that my good friend from Maine just mentioned about treatment centers being filled, detox centers not having room for someone to go to be able to get the detox and then to get into treatment. These are real problems in our communities right now. That's what this legislation is meant to address, not just by an appropriation for 1 year, but by changing the law for the future. And if we do this and do this right, in the next 19 years in this legislation, we will spend even more than we spent on the Drug-Free Communities Act. It will be well over $2 billion will have been spent that would not have otherwise gone out because of this legislation. So just as Senator Whitehouse said that he strongly supports this bill because it is evidence-based, because we spent the right time putting the time and effort into making sure that it will be money well spent, this bill is really important. I appreciate the support of my colleagues, Senator Shaheen, Senator King, Senator Whitehouse. Senator Whitehouse and I have been at this for a few years together. It's the right thing to do for our country at a time when we do face a crisis. And again, I will support the additional spending because I think this is so critical. But let's not go forward with this sense that somehow this doesn't matter. This does matter in a very big way. This is the necessary first step. And in terms of this year, because we increased funding dramatically at the end of the year for this fiscal year, not one penny that has been actually outlaid, by the way. It's been appropriated, but there's been no outlay yet. I believe that anything we could get done this year, getting it through the House, getting it through the Senate, the President signing it, would be funding that we could use for these important care programs just in the next 7 months of this fiscal year. But certainly, we should right now, as I have done, and I know Senator Whitehouse is doing and others are doing, go to the appropriations committees and say, with regard to next fiscal year, let's be sure that we have the entire bill funded. And again, I would support even additional funding beyond that But at a minimum, let's get this done. This is an opportunity on a bipartisan basis to actually get something done to help people who are crying out for our help, communities that need our help, families that are being broken apart need our help. So I appreciate the fact that Senator Shaheen made her best effort today. She was right in my view, but let's also continue to work together to get this legislation passed. With whatever funding we can add to it, that's great with me, but let's get this bill passed to ensure that going into the future we are directing this funding effectively and increasing this funding to help those who need it most. Again, I appreciate my colleague from Nevada, and I'm sorry to take so much of his time. Yield back.